Coli septicemia, a severe form of colibacillosis, is a common infection in the broiler industry due to intensive stocking in poorly ventilated houses. It is caused by avian pathogenic Escherichia coli, a gram-negative, flagellated rod that grows on nutrient or blood agar, producing convex, circular, smooth, gray colonies. These bacteria ferment glucose, mannitol, and lactose but not inositol, liquefied gelatin, or produce H2S. Most pathogenic E. coli belong to the serogroups O1, O2, and O78. Chickens, turkeys, ducks, and pheasants can all be affected by coli septicemia, but it is most commonly seen in young chickens. E. coli can inhabit the intestinal tracts of poultry and wild birds and be shed in feces, persisting in dry conditions. Contaminated drinking water contributes to E. coli challenges, and egg contamination can lead to high embryonic mortality rates and yolk sac infections. Predisposing factors like Mycoplasma gallisepticum and viral infections including Newcastle disease, infectious bronchitis, avian pneumovirus, infectious buccal disease, and coccidiosis, along with nutritional deficiencies, increase susceptibility to coli septicemia. Environmental stress can also predispose birds to this disease. Clinical signs appear in birds between 2 and 12 weeks of age and include respiratory distress, drop in food consumption, listlessness, and ruffled feathers, with variable morbidity and mortality rates 5 to 30%. Characteristic lesions include generalized polyserositis, pericarditis, perihepatitis, airsacculitis, and peritonitis. Affected carcasses often show a dark, dehydrated, and septicemic appearance with congested liver, spleen, lungs, and kidneys and thickened, opaque air sacs. Diagnosis can be confirmed by isolation and identification of E. coli from samples taken from heart blood, the liver, lungs, and air sacs. Prevention and control involve maintaining high standards of flock biosecurity and management and obtaining chicks from disease-free, well-managed breeding flocks and hatcheries. Chicks should be from mycoplasma-free stock, vaccinated against local threats. Treatment might include antibacterial agents based on sensitivity tests, and early intervention is crucial. Over time, monitoring antimicrobial sensitivity helps in the efficient use of medications. Commercial oil-emulsified multivalent vaccines and other vaccines can provide protection against pathogenic E. coli serovars, helping reduce mortality and respiratory disease in birds. Please feel free to ask in comments. Subscribe the channel. Thank you.